So let's talk about the potential complications following breast implant surgery. And nobody wants to hear about complications. Everybody wants happy surgery. And breast implant surgery for 99% of my patients is a positive experience. But there is no surgeon who has zero complications, no matter what they say on their websites. Complications occur, and they don't have to be the fault of the surgeon or the patient. Certain things sometimes happen. The major complications of the procedure are capsular contraction, which means the implant itself isn't a natural part of your body. And so to wall it off from the rest of your body so your body doesn't attack it, you form a light capsule of collagen tissue. Sometimes something provokes a reaction against the implant, and that capsule gets thicker and squeezes the implant, and that's when patients talk about their implants hardening or implants rising or changing in shape. That's capsular contraction. The incidence of capsular contraction has been reported as high as 40%, but in general, in my practice, it's a single-digit occurrence, taking on the most mild to the most severe forms of it. Very infrequent occurrence. If it's seen early, sometimes with medications and intervention, it can be resolved. But there are instances in which surgery is needed to resolve capsular contraction. This is one of the things that requires careful, scrupulous follow-up to make sure that if we notice something even suspicious for capsule, we can start an intervention that might prevent it from progressing to something that requires an additional surgery. We obviously look for the normal complications of a surgery: infection, bleeding, and scarring. Scarring with breast implant surgery is exceedingly minimal. There are different areas in which we can hide the incision, so it's hard to find. Bleeding is way less than 1% in my practice. I can count on one hand in 26 years how many patients I've seen with bleeding. Scarring, like we talked about, everybody gets a scar, but it should be not something that you see. And infection is exceedingly rare. I've seen 2. It's not 0. I've seen 2 in the thousands of cases I've done. And they could be associated actually with poor hygiene, because interestingly, when patients have surgery and you tell them to shower, they're afraid that they'll get an infection if they shower and get the area wet, as opposed to being afraid that if they don't shower, that bacteria grows there, and sticky old dressings are a nidus for infection. So in trying to prevent infections, they're actually causing them.